Assalamu alaikum. So we'll continue our lecture series of the endocrinology, and we're going to study the applied physiology of growth hormone. So let's talk about it. So whenever we are studying the physiology or the pathology that is related, applied physiology or pathology that is related with any hormone, there can be two types of disorders. Either that hormone is being produced in a larger quantity than normal, or that hormone is being produced in less quantity than the normal. So either there would be excess of hormone, or there would be low volume of that particular hormone. So hypersecretion of growth hormone or increased excessive secretion of growth hormone would produce diseases that are known as gigantism and acromegaly. They are kind of on a spectrum, on the same spectrum. They're kind of the same diseases. The main difference between gigantism and acromegaly is the age difference. If there is increased production of hormone occurring before fusion of epiphyses of long bones, that is, before the growth plates of long bones close down, before 17 or 18 years of age, when the child is still growing in its growing phase, then it would be known as gigantism. And the signs and symptoms would be somehow similar to acromegaly, but they would be more pronounced than the acromegaly. Acromegaly occurs after the fusion of epiphyses. So if growth hormones is being secreted in excessive quantities after 17 or 18 years of age, that is after the fusion of epiphyses of long bones, it will be known as acromegaly. And if the growth hormone is not being secreted enough, if its quantity is too low, it would produce a disease that is known as dwarfism. So gigantism is the disease where the patient grows to giant proportions, huge proportions, and dwarfism is when the patient is patient has very low height and kind of look like a dwarf, etc. So let's talk about these diseases in detail. Gigantism. Gigantism is basically a pituitary disorder in which there is excessive growth hormone being released from the pituitary gland, and this excessive growth hormone would end up in acting on all tissues of the body, and the body grows to huge proportions. So there would be excess growth of entire body. The individual with gigantism would look like a giant, would have 7-8 feet height and huge arms, kind of like giants. This condition would occur if hypersecretion occurs before the fusion of epiphyses of the long bone. So if the patient is still in his or her adolescent years, or as a small child, and growth hormones is being secreted excessively, there is hypersecretion of growth hormone, then what would happen in a child? His growth rate would be much faster as compared to that of his age mates. So when if the growth hormone, if this hypersecretion of growth hormone is present since birth, at 3 years of age or at 6 years of age, the child would look like he is 2 or 3 years elder, and his height, his weight would be more as compared to his peers. So this is how gigantism looks like, and it is due to hyperactivity or tumor of gonadotrophs, the cells which are somatotrophs, the cells which are releasing the growth hormone. And this is how a gigantism patient looks like. Look at the height, the stature. So what would we see clinically in a gigantism patient? All body tissues would grow rapidly, including the bones of the patient. There would be huge stature with height more than 7 feet. The patient would be a patient of hyperglycemia. It is seen in about 10% of giants, and full-blown diabetes mellitus would develop eventually because pancreas would stop compensating for the insulin content of such a large body. In most of the giants, panhypopituitarism eventually develops if they remain untreated. So what happens is, growth hormone is being secreted excessively. Now what does this mean for a person, for pituitary gland of a person? The pituitary center for release of growth hormone, that is lactotroph, would be hyperactive and would multiply in large numbers, and eventually these lactotrophs would replace all the other cells of the pituitary. Sorry, not lactotrophs, somatotrophs. And in the end, pituitary would only be able to produce growth hormone. There would not be production of any other hormone from the pituitary gland, and that would cause decrease in pituitary, all of the pituitary secretions except this growth hormone. So panhypopituitarism means decrease in all of the enzymes of the pituitary gland. Because the gigantism is usually caused by a tumor of the pituitary that would grow until the gland itself is destroyed in the end. All of the tissues are replaced by a scar tissue, by the tumor cells. Let's talk about acromegaly. This is also a pituitary disorder which is characterized by enlargement and thickening of bones and growth of soft tissues. This also occurs due to hypersecretion of growth hormone, but acromegaly occurs after the fusion of long bones. So that is after 18 years of age. If some tumor develops in the pituitary gland, or there are some stimuli which are releasing growth hormone in larger quantities, it would cause acromegaly. So after adolescence, that is 15, 16, 17 years of age, after the epiphyses of the long bones have fused with the shafts, the bones cannot grow any longer, but they can grow thicker. The person cannot grow taller, but the bones can become thicker and the soft tissues can continue to grow. Enlargement is especially marked in the bones of the hands and the feet. So the hands and feet, because they are small bones, membranous bones, and they do not have epiphyses, they can grow to huge proportions due to action of this excessive growth hormone. So the membranous bones and the smaller bones in the hands and feet, and membranous bones including the cranial bone, the nose, the bosses on the forehead, matha जिसे कहते हैं, the supraorbital ridges where eyelashes are present, The lower jawbone and portions of the vertebrae uh, grow exponentially due to effect of growth hormone, and they do not stop growing because their growth is not ceased at adolescence. So this is how an acromegaly patient would look like. That is, there would be frontal bossing. Frontal bossing is when there is protruding from in here, in this region. That is protruding forehead. So there would be excessive growth here on the forehead. There would be protrusion of the supraorbital ridge and the broadening of nose. So this part would grow exponentially, and nose would grow broader. That is, it would increase in width, and there would be prognathism. That is, the size of the lower jaw would be increased and it would protrude forwards. So this would grow like a larger chin, and this jaw would be protruding forward. So these were the changes which can be seen in the facial region, head region. So what are the changes that can be seen in the hands and feet? There would be marked enlargement of small ones of hand and feet. So as you can see, a normal hand and hand of a person with acromegaly. The fingers have grown in breadth as well as length. The hand has grown in breadth, length, but the arm is somewhat similar. There would be bowing of spine. The patient would develop hunchback. That is known as kyphosis. And there would be enlargement of visceral organs. Viscera would enlarge. And hyperglycemia, diabetes and hypertension would be common. So these are some clinical features of acromegaly. It occurs due to a pituitary adenoma, which can be seen on CT scan or MRI scan. There would be increased concentration of growth hormone in the blood, and this would cause hypertrophy of sweat and sebaceous glands, so the patient would sweat a lot. There would be galactorrhea. Galactorrhea is increased size of breast in males due to action of prolactin. There would be cardiomegaly, increased size of heart. That would eventually result in first result in hypertension and eventually would result in heart failure. There would be sexual dysfunction because FSH and LH are no longer being produced from the pituitary. It is compensating by just producing growth hormone. There would be peripheral neuropathy. The patient would feel numb in his hands and feet. There would be arthrosis, that is the joint pains, and fusion of joints. Difficulty walking, difficulty standing, difficulty using hand. There would be spade shaped hands and feet. So do you know what is a spade? चप्पू का पता है, चप्पू जिसके साथ कश्ती चलाते हैं. The hands would look like that. There would be smaller arms but broader hands and spade like. There would be odd abnormal glucose tolerance test. This is a test that is done to diagnose diabetes mellitus. So due to diabetes mellitus, due to abnormal production of insulin, glucose tolerance test would result in abnormal findings. And there would be glucoseuria and polyuria. Glucose would be excessively excreted in urine, and the patient would feel the urge to urinate again and again. There would be large nose and jaw. Teeth are separated or lacking due to overgrowth of jaw, but the teeth are the same size. The teeth would separate from each other. There would be spaces between the teeth. Nose and jaw would grow to huge proportions. There would be prominent supraorbital ridge, that is the place where the eyebrow is. It would be prominent, it would grow outward, and there would be visual field defects. The patient would have problems in seeing in the peripheral vision, in seeing the things which are present on the sides. So these were problems which are caused by over secretion of growth hormone. So what happens if there is under secretion? If the growth hormone is not being secreted enough, what happens? The condition is known as dwarfism. This occurs in children where there is not much production of the growth hormone. So if the growth hormone concentration is decreased, if secretion is decreased, it would cause stunted growth or shunted growth in the children. बोने देखे हुए बोने बोने से रह जाएंगे छोटे छोटे से. The decrease in secretion may be due to congenital causes, that is present from birth. Since birth, the pituitary is not producing growth hormone. It can be one of the causes, or it may occur suddenly or slowly at any time during life, most oftenly resulting from a pituitary tumor that destroys the pituitary gland. So if a pituitary tumor develops during any stage of life, it would go on to destroy the normal cells, and the pituitary secretions would be disturbed. Either there would be increase in some secretions or decrease in the others. So it would cause abnormal secretion, pituitary secretions, and many other conditions. In general, all the physical parts of the body develop in appropriate proportion to one another, but the rate of the development is greatly decreased. It means the patient would grow equally with all the appendages in equal proportions. Means he'd have smaller hands, smaller feet, which are proportionally normal to his arms and legs. And the rate of the development would be greatly decreased in this patient. The person at age 20 years may have the bodily development of child, that is 7 to 10 years. Okay, so his age would be 18-20 years, but the body structure, if you look at him or her, it would be like that of 7 to 10 years. And these patients are mentally normal, and the reproductive functions are also normal. So they can reproduce offsprings, and they are mentally normal. They think and do all the course like normal human beings, but the only problem is with their weight and height, etc. Their development, physical development. So this was all for the pituitary gland. Now we have to start the thyroid gland. Which I think thyroid gland would start in another lecture. So let me upload this lecture, and then I'll upload the thyroid lecture tomorrow, inshallah. Tomorrow's lecture would be longer than the usual. And remember, today in the evening I'll be holding a question answering session. That would be 10 to 20 minutes of question answering, and be live on Link Talk or WeChat after the lecture. So in the evening, I'll let you guys know. Be live in the WeChat group. Thank you.